Hello, I'm Dr. Vikas Singhal, a Senior Consultant, Department of GI and Bariatric Surgery at Medanta Medicity Hospital in Gurgaon. So today I would like to discuss about what is bariatric surgery and who is it for. So the most important thing to understand with bariatric surgery is that it is often also referred to as weight loss surgery. So is it just weight loss surgery or is it something else? Then I would also want to talk about what is it? What do we do in the surgery? What are the changes that come about in the body with the surgery? And who is this surgery really for? Is it for anyone who is obese who should undergo this surgery, or there are specific indications, specific criteria that who are the patients who should really be considering this surgery? To start with, I would like to explain that this is bariatric surgery is not just a weight loss surgery. We simplify it or simplify it by calling it weight loss surgery. But effectively, this is a metabolic surgery where we are changing the digestion or the metabolism in the body so that you don't just lose weight, but you get rid of a lot of metabolic problems such as diabetes, blood pressure, high cholesterol, increase the mobility so that you can walk around much better, reducing the stress on the joints and reduce the risk of developing, worsening of the arthritis. There are, substantial benefits such as reduction in the risk of heart disease, reduction in the risk of stroke, reduction in the risk of several cancers to develop in the future that are associated with obesity. Additionally, there is an improved quality of life. There is a good, well-being about yourself, where you feel not just physically but also psychologically much better. You have a better body image. It's overall the aim of the surgery is to improve the quality of life. So I think it would be wrong to just call it a weight loss surgery, because yes, a lot of these problems are associated due to excess weight or obesity, but the surgery is not just a weight loss surgery. In fact, losing weight is a very healthy or a great additional benefit that comes with the surgery, apart from all the metabolic benefits that come with it. So, the next thing to discuss would be that who is the surgery for? Somebody, we get a very wide range of obesity. Somebody may be 5 foot 6 inches and 80 kg, that is also obesity or the early class 1 obesity, and somebody may be 5 foot 6 inches and 100 kg, and that is what we say class 3 obesity. Then somebody may be much higher weight at the same height. So how do we assess that somebody would require this surgery? One of the simple measures is the body mass index or the BMI. It's a very simple measure. You can download a BMI calculator on your phone, and it can very easily put in your age, your height and weight, and it can tell you what is your BMI. And if you're looking at a BMI more than 30, then you are looking at obesity. And if you are BMI more than 38, that is where in the Asian population bariatric surgery is recommended. And why is that? Why is that at a certain BMI we recommend bariatric surgery, while other measures such as just diet and exercise would be enough for somebody who's around BMI 30? So it's very important to understand that if somebody has extra 30-40 kg weight, then it's very difficult to lose that weight and maintain it just with the help of correct diet and exercise. The correct diet and exercise needs to be done regardless whether you are 10 kg excess weight, 30 kg, 50 kg excess weight. You need to follow the correct diet and exercise. There is no substitute for that. You may, even after bariatric surgery, it is important that we follow a correct diet and exercise to take care of our health, to invest in our health. But yes, bariatric surgery is recommended in the Indian patients at BMI more than 38 or BMI more than 32 with comorbidities such as diabetes, high blood pressure, high cholesterol, where the obesity has already started to cause metabolic problems, and we find that we need to address obesity quickly. Otherwise, the complications of the excess weight or obesity can multiply with time. So these are the specific criteria where bariatric surgery is recommended based upon the BMI. There are several other factors. We look at the overall picture. Somebody may have a lot of breathing problems, sleep apnea, where a lot of snoring, you can't, keep waking up at night, you feel very sleepy in the daytime. That is something we find very commonly associated with obesity. One of the best treatments for sleep apnea is bariatric surgery, because you lose weight and the sleep apnea gets cured in about 90% of the patients. The breathing becomes much better, the sleeping becomes much better, the quality of life substantially improves. So there are several measures that we need to look at, several indicators that we need to look at. But to summarize, if you have tried and you're struggling with losing that weight, especially if you are 30 kg excess weight for your height. For example, if you are 5'6" and your ideal weight should be 60-65 kg and you're about 90-95 kg, then yes, you would need to consider bariatric surgery, because for the vast majority of people, it is very difficult to lose that kind of weight and maintain it with just diet and exercise, because the weight loss we see tends to come back, and you need that additional help from the surgery, where the metabolic, the changes that happen, how the digestion changes, how your calorie burning improves, you need that additional help from the surgery. So what does the surgery do? There are different types of bariatric surgery. There is a sleeve gastrectomy, there is a gastric bypass. There are the two common types of bariatric surgery. In the sleeve gastrectomy surgery, the stomach is made small so that your calorie intake goes down and your calorie burning goes up. So there is a change in the digestion. Similarly, in the gastric bypass surgery, there is not just restriction of the diet, there is also malabsorption. So you are not absorbing all the calories you take in. Some of the intestine is bypassed and the food goes straight into the lower intestine, so that the absorption of some of the calories is reduced. So these are GI surgeries, gastrointestinal surgeries, where the body's digestion is changed, the calorie intake is reduced, the calorie burning is improved, body's hormones start working much better. So please do not confuse these with cosmetic surgeries such as liposuction or abdominoplasty, where just some of the fat is removed, because there are specific criteria for those cosmetic surgeries, while bariatric surgery is a metabolic surgery, which the idea is to change the body's metabolism and treat a lot of chronic illnesses such as diabetes, obesity, cholesterol, etc. So I hope with the help of this short video, I've been able to explain to you how bariatric surgery is not just a weight loss surgery, but a surgery with extensive metabolic benefits. And when do you need to consider this surgery, at what weight, BMI, and how does the surgery bring about changes in the body to help you lose that excess weight and maintain that weight loss.